people want to know what they can take medically, naturally to boost their fertility and chances of getting pregnant. And I'm going to walk through the most common fertility medications, natural supplements, and let you decide what makes sense for your body and your journey. But remember, things have to be individualized. This is general medical information. Talk to a clinician before choosing any path of action. I'm Dr. Preston Parry. I'm a board-certified OBGYN and infertility specialist. I'm also the inventor of the Periscope approach, where people can figure out most of their fertility in 10 to 20 minutes in a single office visit. And this whole channel is based on evidence-based approaches and answers to understanding and regaining control over your fertility. So if you have questions or insights and want to ask about things, let us know how we can help you on your journey. So back to the question, what medications are most commonly prescribed to improve fertility? And there are really three categories for how you go about it. One is you are taking some pills to rev up the eggs. One is get injectable medications to rev up the eggs. And both of those two are with or without insemination. And then the third is IVF, where you add some extra medications on top of the shots. So what are the oral medications that people usually use to improve fertility? When you're taking pills to improve fertility, it's usually designed to getting extra eggs. Almost all the other pills don't clearly seem to increase fertility, although prenatal vitamins can decrease miscarriage, can decrease birth defects. But at the same time, there doesn't seem to be a clearly branded prenatal vitamin that I've seen convincing data. Hey, this is the one, this is better. Otherwise, we would all use the same one. So beyond prenatal vitamins, the core pill that seems to make a difference ends up being to use clomiphene or letrozole. Some people can even use tamoxifen. Clomiphene is a way of basically blocking the brain's recognition of estrogen. The brain says, oh, I'm low on estrogen, let's make some more eggs. And it churns out this hormone called FSH from the pituitary, which is follicle-stimulating hormone. And then all of a sudden, your ovaries see the FSH, and it makes more eggs. Letrozole blocks the change into estrogen. So instead of blocking the brain's recognition of it, it just means you have less estrogen in the body. And then with the lower estrogen, again, the brain says, I need to make more, and stimulates the ovaries to grow eggs. Tamoxifen is sort of much more similar to clomiphene. Most people don't use it, but there are some rare cases where it can be used for fertility. What are the shots then? Besides HCG, by the way, people use HCG often as a way of triggering ovulation. You've heard of the LH surge, which is the hormone from the brain to say, okay, release the egg. And usually it's done when estrogen reaches a certain level on its own. Well, you can just give HCG, which is structurally similar to LH, and get the body to ovulate. You can also give gonadotropin. So that's the purified LH and FSH from the brain. It will have LH, FSH, and even HCG working a little bit like LH in there to stimulate the ovaries. The final medications that are really used for is more of an IVF approach. And that's when you're not only getting the LH and FSH through various brand names, Gonalef, Follistim, Menopur, others, but then you're also getting a medication to keep you from ovulating, which can be Leuprolide, which is Lupron, Ganirelix, and Cetrotide. These are GnRH antagonists, so they're given at different times. And there's some other variants. And people can even start using progesterone to do that these days. But the quick version is people are using medications to get your eggs to grow. Think of the FSH as the quantity hormone, LH is the quality hormone, and you got to have the right balance of each. You got to have something to keep you from ovulating, and you've got to have something to release the eggs. Those are the core fertility medications. When should I start thinking about using fertility medication and not trying the old-fashioned way? So first, If you have risk factors, if you have something going on, your tubes are tied, you don't ovulate, your partner has very low sperm counts, obviously, if there are huge flags saying you may need some support, talk to a clinician about what medications will be right for you. But ultimately, getting a boost is appropriate when you're finding you have low chances. Now, if you are 30, you've had unprotected sex for a year and haven't gotten pregnant, usually that means you're running about a 3% chance per month of a spontaneous pregnancy leading to a live birth, which means in a given month, 97% chance it's not going to work. That's really the statistics. The first month of unprotected sex, it might be 40%. There might be phenomenal odds. 3 months in, you might be running 20%. So there's still very good odds. On average, 75% of women are pregnant successfully within 3 months at age 30. And if you've gone a year, you should have been pregnant 2, 3, 4 times by then. So I would say first, if you think you need medications, you may want to work up just to say, is something going on? Because you can give all the pills in the world. Your tubes are blocked and sperm and egg aren't going to meet, or the guy is firing blanks. Semen analysis, you may want to figure that out. But then if you're getting medications, a lot of clinicians, they don't have much in their toolbox. And they say, here's some pills, let's see what happens. But here's the thing. If you get letrozole, Clomid, and you had a 3% chance a month, and you didn't change sperm, you didn't change tubes, you didn't change the years, you went from 1 egg to 2 eggs. How much did you change 3% a month by getting a second egg? It takes you closer to 5%. So often for people to be effective, they need more than just pills. It's not that it can't work. And especially for the anovulatory people. If you don't ovulate regularly and you go from 0 eggs to 1, that makes a huge difference. The person who's got 5 years of infertility has ovulated 60 times, and you give them a pill and they went from 60 eggs where they could have gotten pregnant to 62 instead of 61, it didn't really change where their odds were. What are the common side effects and risks of fertility medication? So there are a lot of things. First thing to really talk about is anything that can happen with a normal pregnancy can happen with fertility medication. Not pregnant, miscarriage, prematurity, birth defects, ectopics, twins. Again, if it can happen normally, it can happen with fertility medication. Now, with fertility medication, that revs up the number of eggs you take. The more eggs you get, the more likely you are to have multiples. And I can tell you, it's been over a decade since I've had triplets from IVF. But with pills, I've had several sets that sometimes the body fools you and just doesn't want to read the book. So if you're revving up the eggs and there are more eggs, more may take. So that's something very important to think about. For clomiphene, I do see a lot more hot flashes relative to letrozole. Obviously, dose matters, but when it blocks the brain's recognition of estrogen, the brain starts thinking it's in menopause. That's why it makes higher FSH levels to get extra eggs. But that can be an important side effect. Another thing Clomid does, or clomiphene, is it can thin the lining over prolonged use. It has a longer half-life, so that where just how long it lasts in the body, so that matters. Letrozole, I don't see as much on it has a shorter half-life, so it clears from the body more quickly. I can sometimes see a little fatigue with it. I don't tend to see as much for the hot flashes or dryness, but I think everyone's unique, but those are sort of the most common side effects we see. The injectable medication, as you start getting to, especially IVF, where instead of getting 2 or 3 eggs, you get 22 or 23. That's where you see a lot more of the bloating. You can see hyperstimulation syndromes, and how a clinician manages OHSS, how they find the right balance of safety and success for you is important. Talk with your clinician about where you want to be for that balance. Do you want something that's more aggressive and you're more bloated, but then you've got more eggs? Or do you want things to be a little more laid back with more risk, you might need to do IVF again and have less buffer for your future family. Are there medications that you can get over the counter that increase your fertility? If you can find them, email us and we would love to explore it. But the truth is, I haven't seen anything convincing. It's not that you can't find this anecdote from a person who tried everything else and then finally took this pill and they got pregnant. That just may have been their time. And the question is there a well-designed study that actually shows, hey, you give 200 women, this pill, and 200 women don't take it? What is the difference in their fertility? To get a well-designed trial like that, I haven't really seen anything convincing for over-the-counter, beyond prenatal vitamins, that make a difference. What natural supplements or vitamins are commonly used to support fertility? Again, prenatal vitamins is the core one, and particularly folic acid seems the most important in preventing birth defects. In fact, if you have a family history of spina bifida, if you have a history of, again, neural tube defects is the broader category, if you are taking anti-seizure medication, there are lots of people who actually need extra folic acid. Some people where they're talking about MTHFR, there's a lot of debate as to whether you need to take extra folic acid or switch over to folate for that. I think talk with your doctor individually about that. Many people are saying that actually those people are fine with folic acid, though others disagree. But the key thing is making sure you get enough folic acid and talk with your doctor about the dosing, but that's one of the most important things about prenatal vitamins, which give you differences from regular multivitamins. The other thing is you can also get too much vitamin A. Now, I haven't heard of a person overdosing on carrots and having a problem from that. But if you take synthetic vitamin A, which is often in supplements, people can get too much vitamin A and cause birth defects. Can natural and medical approaches be used together? Anything can be done. The question is really, what do you get for what you're doing? And I'd say always coordinate with your clinician for any medical decision. Don't do it on your own because you don't know what you don't know, and then you could get something wrong that could be serious. There was a great study, I believe, out of the Netherlands several years ago, and they had all these people on supplements and natural therapies, and they weren't allowed to tell their doctor, and they wanted to see how they did compared to other people. I think it was like several hundred people that were in this study. And what they found was that the people who were on all these supplements and natural approaches that didn't tell their doctor, some did get pregnant, but on average, they were 40% more likely to do worse than the ones who did coordinate with their doctor. There can be plant-based estrogens, which can actually potentially interfere with ovulation, or it can throw off the window or the timing. There are lots of little things that matter. So you definitely want to coordinate to make sure you're not making yourself worse or trying to make yourself better. Lots of research on this where people say, other stuff hasn't worked, let me try X. And then it's not that they are changing it up. They're more likely to do worse than better. That's really important to think about. So talk with a specialist. When should you see a doctor before taking anything? And again, you have to have the right person. But before you start on a fertility journey, there's so much craziness out there. The ability to coordinate with someone who really knows this well, does it every day of their life. And there can be great nurse practitioners, advanced practice providers, but the more you get to someone who specializes in something, and the more advanced their training, the more likely they've figured out what works, and the more time they've spent. I have a lot of respect, not just for title, but for time and experience, where people can say, I have this track record. Let me show you what's worked in my experience. Why should someone who wants to get pregnant take prenatal vitamins? Really good question. I mean, let's face it. Some of these things are horse pills and they taste horrible. By the way, we took gummies for both of our boys. They seem to have turned out okay so far. So With prenatal vitamins, they're the building blocks for a successful pregnancy. And remember, your body, if you are pregnant, needs buffer. So, what are you looking for in prenatal vitamins that you need most? So, first is folic acid. Folic acid tends to help prevent neural tube defects, which are spinal defects, and the most common birth defect for newborn babies. Most people are running about a 1% to 2% chance, and having extra folic acid often will cut that in half. So it's very important for many people. Next thing, you want calcium. Women actually lose a lot of calcium from their bones when they are pregnant. Usually they can catch up afterwards, but calcium is something the baby tends to take on very quickly and need a lot of. So it's good to have those reserves. The third thing is iron. Now, some people may disagree with me. This is my personal take. And so I coordinate with a clinician that would prescribe for you. When you have pregnancy, your blood volume increases by 50%, and you need about 30% more hemoglobin, which is the part of the blood that binds to oxygen and helps you breathe, and then also circulates the baby to help it get oxygen. And if that's expanding and you need more than usual, you want to have good buffer before you get pregnant, and then also having a lot while you're pregnant. I think a lot of the blood volume tends to expand a little more in the second trimester than the first. So one thing for people who have a harder time with prenatal vitamins, I say, look, get the chewies and the gummies, generic, all those things before you're pregnant. And then once you're pregnant, that's probably even more of a transition point to switch over to the full prenatal. So you've got some time at least where you don't have to take those huge horse pills, because much of the volume of the horse pill is really from the iron component. And so that gives people a little bit more flexibility. However, if you're iron deficient and you don't get iron from other parts of your diet, it may be more important for you to have the larger prenatal from the get-go. But if you have good reserves and you're good with that in your natural diet, you may not have to be so aggressive about that. By the way, when talking about gummies, I am not talking about anything that contains THC. I'm just talking about soft, small uh, prenatal vitamins. So thank you so much for watching. If you find this of value, share with your friends and like, subscribe, follow, and don't suffer in silence. There's so many ways of getting support. You are not alone. There are people who've been through this and care about you and want to help you get to the other side. I know I do. I know my whole team does. And I'm sure there are many more. Get support and good luck.